Today's topic is you have already learned about the planning cycle and strategic planning, correct? What is the first step of planning cycle? Analysis of any problem. Planning cycle is not for health management only, it is for every day. You can use it even for your exam preparations. Planning is the thing that will get you ahead in the next game of yours, whatever, if that is pursuing NEET-PG, even MBBS final year is also a very vast subject. If you do not get your priorities set, which chapter do I have to pressure on, which chapter I have to read lightly, you will never finish it, okay? Because that's a branch which will go ongoing, still ongoing. New drugs, newer surgical techniques, newer modes of investigation, everything is coming up, and you also have to remember the old ones. That is why use these planning cycle steps for your preparations also. Okay. So before going to that, can you tell me that is planning cycle which is part of management. What is the goal of any management? Why do we have to keep a management system? Health planning management, chapter you have started, planning cycle is over, but just simply tell me what is the role of any management? Why are they here? Why is it needed? Organize or improve. And how will he achieve? Obviously, if you think about any company, probably a startup company, they have to give higher productivity, lower cost, and obviously it has to be hassle free. And what we expect that every person in that company is doing their work assigned, not outside of that, not below the grade, not even the work, and also at the optimum level, not below the performance level we do not expect. That is how any corporate works actually done. Here are many techniques today we learned about, okay, some older, some newer. In your textbook that is divided into behavioral and quantitative, but today we will divide the quantitative into some more techniques, some more categories also, okay. Before that, what is the management's role? That management is all about getting the right things done. How? In the right way, in right time, by the right persons, and with the right amount of resources. If for any place you have man, money, and 3M for any work. Man, that means the workforce or human personnel. Money, that means resources. And what is the third M? Okay, leave it there. It is methodology, sometimes materials, anything. In our health management, we usually divide it into 5 types things, okay. 5M. Suppose we are getting an example, taking blood pressure of a person. If we get into first 3M, that last M was methodology or materials. Get into the materials. What material do we need? BP মাপতে হবে কারো, we have to one sphygmomanometer and stethoscope. Other, obviously first we need a subject. of whom we will measure the blood pressure, and there has to by now by your OSCE you know there are some conditions. The patient has to be relaxed state. So materials and also what we need, a chair, suppose bed, also these things. Now what you said, a proper material or instruments, that is a sphygmomanometer, just or stethoscope. Is that the only word? Think specifically that sphygmomanometer has to be properly calibrated, and obviously it has to be in a working function, otherwise it won't measure. So second thing is machine or sphygmomanometer. Third is money. We need the money to buy these things, otherwise we cannot measure. Then the most important thing, that is you guys who will measure the blood pressure. That means a man who is trained enough or trained accurately, and obviously he knows the methodology. That is the rest of the 2M, man and method. If a man he measured blood pressure at least 100 times, but he doesn't know the actual methodology, his training is not enough. That is the 5M, man, method, money, machine and materials. The arrow is actually giving one way, I presented the boxes in another way. So that's how it works. If it is asked in your Viva what are the 5Ms, these are the 5Ms, okay. And these all things comes when the management is right. And what are the uses of these management techniques that we use in our daily to day basis in our health sector? Obviously finance sector. As you know, every national program needs funding, and where to spend how much, what amount of the total money has to be spent on IC, what amount money has to be trained for capacity building. These things we have to decide. For that we have some management techniques. And also suppose you are running a vaccination center, which vaccine you need more, which vaccines you need less. If we are stocking for throughout vaccines throughout the year, obviously the number of OPV vials and the number of BCG vials will be different. Why? Because BCG vials is needed as per the birth rate of that area, but OPV vials needed much more than that, because how many OPV doses are needed for a child in 1 year? How much? Obviously there are first birth dose, then 6, 10, 14, 4 and then booster doses. Okay. There are formulas that are not needed for you. Okay. That, and obviously there are wastage factors. These things, that every vaccine vial contains dose for 5 persons, correct, or 10. What is the amount of a OPV vial? Not a single vial for single people, na? One vial can be used for anyone, 10 ml or 5 ml. What is the quantity of the vial? 5, okay. And what is that for BCG? দুই 5 10 কত 2 আবার ভ্যাকসিন গুলো প্রবলেম কার্ডের সঙ্গে ধরাতে হবে, ওকে। So what are the other sectors? Obviously marketing. Right now there are many pharmaceutical companies they all have to sell their product, and for that they need correct marketing strategy. Obviously operations, how to run the hospital with the personnel that you have, how much medicine doctors you need, how much gynae doctors you need, and obviously if we need 5 medicine doctors to run a hospital, how many cardiologists we need? Is it more than 5 or is than less? For a day, to run a hospital for a day, if we need 5 general medicine doctors, how much cardiologists we need? Less than 5 or more than 5? Less than 5, obviously, because these cases will be nominal. Then obviously human resources, that they are to manage the health personnels, okay. And information technology, that means to keep a database of the health personnels and patients, and these database can be used for proper employing of proper management techniques. For that, these are the sectors where management techniques are needed. And also these are the same thing, the relevance, overlapping, conflicting and competing organizations there are in the health system. There are too much private hospitals or government hospitals are there. They have also, if there are number of personnel is more, but their scheduling is not right, then there will be overlapping of the schedules. And scattered funding throughout the medical research. We need, suppose we need $1 million to run a chemo drug, and we need $3 million to run a clinical trial on a antimicrobial. So should we only develop new chemo drugs? Obviously antimicrobial, because antimicrobial uses are more. Cancers are less in prevalence and incidence. These kind of decisions you have to take. Now coming to the techniques. There are some traditional and modern management techniques. Traditional techniques that are in your park, it is written as behavioral techniques, where we did not employ any mathematics or statistics or some scientific method that is proved over time, but what we did we thought that we will deal them by one person at a time, and for that behavioral techniques came. If we behavior like some model, they will, the persons or health personnel, if we get them into a construct that I am your boss, you have to work, these are your roles, they will work like that. That we thought, and for that we employed some techniques, some organizational techniques. Obviously we are getting into some personnel selections, training, motivational methods, leadership examples, managerial techniques. These things will come your way, and later when we see that these organizations are, the persons involved in this organization are getting bigger day by day, there we cannot conduct them in a one-to-one basis. Then we employed some statistical techniques. These actually statistical techniques or inventory control and some financial management techniques also. These are now known as modern techniques. Some of the modern techniques are given in your textbook. Today we will talk with only about that, okay. You do not need to know about the inventory methods such as or queuing theory, okay. Just remember, I will give you the list, just remember the names, you do not need to know in details. Today's class will be only on the points that are written on your textbook. But if any of you are interested in doing MBA in later after your MBBS, you can ask me, I will share the presentations. Okay. So, traditional techniques, these are conventionals and were no longer adequate. What are the modern techniques? They were based on sociology, psychology, economics, statistics and educational technology, and they are applicated for larger and complicated organizations. Okay. If there are some explain why is needed, what is the difference between a network analysis and organizational analysis or organization. These are the points you have to write, that network analysis is coming from modern techniques which was applicable for a larger and complicated organizations, where the organizational techniques or human management, these techniques were older one which was based on one-to-one basis approach. These are the classifications of modern management techniques. Okay. Just remember the major headings: activity analysis, mathematical techniques and financial and obviously miscellaneous. These are the statistical techniques which are time trends and forecasting and decision tree. Okay. Just remember the names, and if it is asked in a long question, the usual question comes in this part is either write down one or two specific modern techniques, suppose part and CPM, or give a list and then again write about that 5 plus 5 plus 5. Okay. Some advantage or disadvantage also might be asked. If this kind of questions come, if you write like that, that conventional techniques, that list is given later, and after that modern techniques divided in this way. This division is not given in your park. Okay. You do not have to remember all the things, but try to write the major headings and at least 2 examples out of that. Okay. Statistical techniques that we know, see, that time trends and decision theory or decision tree. Activity analysis are time and motion study, work sampling that you need to know, queuing theory and Gantt chart. Then mathematical techniques are simulation models, systems analysis, system analysis you need to know, then linear programming and inventory control, and the most important out of these are network analysis, part and CPM. Okay. Financial techniques, only 3 of it are given in your book, that is cost benefit, cost effectiveness and cost accounting and analysis. Zero based budgeting is not in there, and there is a brief note on input and output analysis. So, those are important. Out of them, cost benefit and cost effective you must have to understand. And there are miscellaneous, there are management by exception, situation analysis, SWOT analysis and log frame analysis. These are the classification of modern management techniques. But before going into the modern techniques, we have to know the conventional or previous ones. So, those are based on behavioral sciences. Why? So that means no math and statistics are needed. First of them is organizational design. If we think about an organization, what is there? There are a bunch of people and someone is their boss. Sometimes a boss have another boss, and obviously there is a supreme boss or godfather or the director, whatever the title that is. And finally, there is one founder of the company. Who is the founder of the Amazon company? Bezos, Jeff Bezos. He is the founder, but is he the director or CEO, or the term we know now, CEO? Is he the CEO? Who is the CEO of Google now? Sundar Pichai, but is he the founder? No. Apple, we also know who is the founder? Steve Jobs. But is he the alone founder, or does he have he has some friends? That is debatable. Okay, but he has some friends, they were partners first, then they split up. Let's not get into this. And also our Flipkart, it also has one founder, but CEO is another one. That is an organization, what I am talking about. One person invents the idea, but how to run, that is decided by CEO. CEO has some people, some will see the operations, someone will see the finance, and someone will see the human resources. That means whom to recruit, who are getting along with the company approach. Okay. In park, it is written very haphazardly. Okay. Just try to remember this organization look like. There will be some boss, under that there will be some people, under that the whole team, and it's running like that from top to bottom, just like a pyramid. At the bottom maximum people, at the top lower people, okay, fewer numbers of people. So if we think about our cricket team, is that an organization? That is an organization, na? Obviously there are some selectors, just we can exclude the selectors. Who is the coach? India cricket team coach jano na? Who is the coach? Gautam Gambhir. And now we have 3 captains for 3 formats, correct? And under the captain, the entire team is playing. If captain, and obviously there are some vice captains who in the absence of captain will act as captain. So that's a reserve spot. Now 2 types of organizations we see. One is centralized and one is decentralized. Centralized means the order will come from the very top, okay, and that order has to be followed by all the people, okay. But decentralized, suppose in our state previously, for running of any program, okay, to running of any program, suppose NPNCD, okay, central usually sends the fund, but where to allocate the fund, whether it is to treat the hypertension or whether it is to treat the diabetes or to generate awareness on the cancer, that decisions were taken by the state governments or state officials. These are the example of decentralized. But if it was a centralized program, if the order from central comes to spend the entire money to awareness generation of cancer, so whether in your state you have much number of cancers or not, you have to spend that money on the cancer awareness, not in the treatment of diabetes. These are the basic difference between a centralized program and a decentralized program. For our national programs, we have one centralized, that is NTEP. Okay. For NTEP, in which part we have to allocate the money and how much, that is decided from the central TV division, and all the state TV divisions, they can modify somewhat a bit, okay, they have some provisions, but they have to spend the money on that purpose only. They cannot spend the money meant for another fund to anywhere. Suppose the money is came from EDNS, that means energy dense nutritional supplement. energy dense nutritional supplement, but state cannot spend the money on buying the drugs or awareness generation. That is how a centralized national program and a decentralized national program run. What are the advantage? The well designed organization structure can lead to improved communication, productivity and innovation. But is it applicable for a large organization? To run this kind of organization, there has to be fewer numbers of people. Boss has to know each and one of your workers in person, so that he can assign specific works to them. But for a large operation, suppose it is a 10,000 worker industry, boss cannot run like that. So, this kind of techniques become obsolete. Then obviously coming to personnel management, that they are also taking the basic thing of the management, that we have to employ the right person, the first motto, that we have to employ the right person. For that also the human resources section have to choose the workers and interview the workers personally, a one-to-one approach. By that, after that they will decide, okay, this person is probably suitable for inventory management, or this person is suitable for operations division. These are the kinds by which previously senior manager or floor manager roles were chosen in a factory. But if you have multiple facilities throughout the country, suppose it is a Blinkit hub in Bolpur, Bankura, Kolkata. Kolkata has 3 Blinkit store fronts. You have to employ 3 people, or suppose you are in charge of employing store managers for Blinkit throughout the West Bengal. Can you interview each one of them? Is it possible? Obviously possible, but it will take time to choose the right person from the huge number of applicants. So, this personnel management thing also came to, it is not used now, okay, for larger organization. What it does, effective personnel management can result in improved employee satisfaction and productivity. If we choose the right person, he will be satisfied. Job satisfaction is a huge thing. If some person is not satisfied with their jobs assigned, the productivity will obviously hamper. It is right for even all of you. Suppose you got into post graduation in dermatology, but after 2 months you are not getting the satisfaction. Every skin lesson is coming to a look same to you, or you are not getting enthusiasm in reading the topic. Will you become a good dermatologist? No. But in MBBS you loved to read the dermatology. Obviously only 15 numbers, some specific short notes you have to read. So you love to read, yes. But when you become a dermatologist, you are not getting the satisfaction from that job. Also there are some techniques we use in personnel management for getting the productivity. Suppose if we offer incentives or some prize or some position, if you work good in this section, we will promote you to this. Even for you, so that you could study harder, you have Super 15 gold medal exams, correct, and even honors. so that if you study that subject hard, you can later write in your stamp honors student. Obviously, you will have to show others that I am better than some others by getting honors in that subject, or I was a gold medalist in that subject. You will not write on MBBS, na? MBBS, then gold medalist. We don't know, suppose you are gold medal in some other subject and you became doctor in other. Might happen. But you will say, I am gold medalist and I have proof for that. Clearly that these kind of incentives, some organization or factory also propose that if you show a good performance, we will give you puja bonus or Christmas bonus, something like that. These techniques actually what we are talking about actually employed by some well known companies, okay. From them we getting the examples. Now communication, that communication part is much more important in our sector, and what we can communicate about, it is not gibberish. We have to know what to communicate, whom to communicate, when to communicate, where, and obviously how to talk. Okay. If we are talking with your friends, you will say some things in a manner, but if you are talking with your teacher, is the manner will be same? No. And obviously you can probe your friend at any time, even late at the night, 2 AM. But can you probe your teacher about something late at the night? Obviously not. Same thing. These are the communication that also needed for management techniques, okay. And this communication has to be one way or two way. Both have some advantages and disadvantages. Obviously, two way comes with feedback, and one way communication is nothing but direction. Both are employed in health systems and both are needed. What are the what communication should be two way? Obviously, doctor patient relationship, it has to be a two way. Other, if patient doesn't get to say whether he is feeling better or not, can we know whether the treatment is working or not? No. And also there has to be communication between one doctor to another. Suppose a problem, PCOD, now known as PMOS, it has some gynecological problems and also some metabolic problems, just as insulin resistance. Insulin resistance will be treated by one general medicine doctor or suppose endocrinologist, and obviously PCOD sometimes results with infertility, secondary infertility. These things will be treated by gynecologist. If a one person gynecologist and endocrinologist doesn't communicate with each other, will it be good for patient or bad? Obviously bad. These are the two-way communications. And what are the one-way? Suppose I am telling you, you have to present your family studies by this end of month. That was a direct order. I will not hear about your feedbacks. What I am telling, that's an order and you have to obey that. Okay. Otherwise, there will be repercussions, obviously. These are the one way. Here are some examples of two way and one way. What are the two way? Doctor patient consultations, therapy session, health hotline, support group. What are the one way? Public health announcements. Suppose from this day onwards there will be lockdown. To break the chains. Did government ask for our opinion? They asked for opinion from some experts, but did they get opinion from the general population? No. They have to do what is needed for the betterment of the society. So that they did. Also posters and brochures. Whether government is asking to prevent TB, what we have to do? No. They are giving us direct directions that keep away from the potential TB suspect, keep the distance, cover your mouth, use mask, these things. Also there are some newsletters, information signage or some TV or radio announcement. Can we argue with them? Can we give them our feedback on the TV? No. আমরা রেডিওর সঙ্গে কোনো ঝগড়া করতে পারি না, কেন রেডিও শুনতে পারে না, শুধু বলতে পারে। Simple things. These are the one way. Now coming to the next, health management information system. Later in the 80s and early 90s, one thing emerged, that information is money. If we have to use them, if we have to get a employee work, we have to know about the everything about that employee, whether he studied, what are the subjects he actually expert. Is he expert in the art section? Then we will put him in the campaigning section. Is he better at the commerce part? Then we will get into him accountancy. This information gathering system was health management information, and later we developed that or employed that technique into patient database also. What kind of food the patient is liking? If he is liking some tasty or some protein rich foods, then we will give him same diet, same bland diet, but it will be rich in protein. If he is not liking protein that much, then we will try to shift that to carb, but the calorie will be the same and everything is same. And motto of health management information system, to gather as much as data from the person as possible and use it against them to develop use it against them to develop policies. Okay. And also from that health management information system, we developed integrated health information platform or IHIP, which is a important short note for your upcoming exam. Okay. What is IHIP, what it contains? IHIP I think we discussed earlier, but in which principle it based on? This is that. Okay. Now management by objectives. This is the last of the behavioral techniques. Okay. Only 5 of it's there. Behavioral techniques, that will, and it is by management by objective. That if we fix some prior objectives at the very early of the operations. If you set in getting into the MBBS course, you have set one objective, we have to pass the final MBBS exam, and obviously it is in one chance. For that, what you have to do, from one objective it comes your second objective, then we have to probably pass all the other MBBS exams in one chance. From that we get to at least get 50% numbers, that is the passing mark, na, 50%. 50% marks in each subject. Obviously in some subject you are strong, in some subject you are weak. Suppose you are strong in anatomy first year subjects, anatomy, biochemistry and physiology, but very weak in pharma. You cannot remember all the interactions and exceptions. You cannot remember. Something is hepatotoxic, some is hepatoprotective, some is renal protective, some is renal toxic. You cannot remember. So suppose pharmacology in you are weak, then you obviously you have to management your time just that way. You have to give more time in pharmacology because you have to get the 50%, but you will employ only that much time, that so that I can get 50%. And you are strong in anatomy and you have a chance of getting suppose gold medal in anatomy. So you have to employ that much time into anatomy part. Day is 24 hours for all of you, but how you are using it makes you a efficient time manager, and the efficient time manager you are, that much the chance of you in getting success in life. Okay, this is the management by objectives. You have to set your objectives prior to the task. What kind of outcome I expect? From that outcome, you have to form your objectives, and you have to work by that rule to gain objective one by one. All of them are some conceptual things, all these 5 things, and these are the called behavioral techniques. I have class in also second half, that class will be longer. 5 behavioral techniques is there, 10 quantitative techniques are in that part. Okay. But before going to second class, I want to give you, some of you, one introspection into yourselves. এই এখনো হয়নি ক্লাস শেষ, হ্যাঁ 1.5 ঘন্টা তোমরা শুনবে তো শুনে নিও, কেননা বই থেকে পড়ে যেগুলো পাবে না, খুব ছোট ছোট করে আছে এবং খুব ভেগ লেখা আছে, তোমাদের ভালোর জন্যই, শুনতে হলে শুনো, নইলে তো অবভিয়াসলি প্রায়োরিটি অন্য থাকলে আলাদা ব্যাপার, হোয়াট এভার। দেয়ার আর ইন ম্যানেজমেন্ট one term actually get into one man or one person's introspection, that calls a Johari window. Any of you heard the name of that? Johari window? This Johari window, what he is saying, that every person has 4 self. Okay, 4 selves. If we divide one's attributes, suppose one person, he has some attributes, or in বাংলায় যদি বলো কিছু গুণ আছে, কিছু দোষ আছে, there are some merits and obviously there are some faults in a person. It has 4 self. Self means that book self is self. ওকে, বাহ, বুক সেলফে সেলফের মতো 4টে সেলফ আছে। তোমরা ফিজিওলজিতে এইরকম সেলফ দেখেছিলে, যে বডি ইজ অল অ্যাবাউট ইসিএফ অ্যান্ড আইসিএফ, কারেক্ট? At least যদি osmosis হয় তাহলে from extracellular fluid it will come to intracellular, or if it is diffusion it will distribute in the equally, ঠিক আছে? So now he is also saying, first there is 2 self from the aspect of one person himself. আমাদের নিজেদের চোখে আমরা নিজেরাই যদি ভাবি, if we think about yourselves in our own way, obviously we have some merits, we have some good attributes or good things, or some bad, that we know, but we cannot get rid of it. That is the self person. এটা বড় করতে হবে। Self, obviously I know about these things. Suppose some points are there, that suppose I know swimming, and I read comics. Although I am 30 years old or more, still I read comics. I also indulge in singing, these things. Every one of you has some good things and what I don't know, suppose I get into anger pretty quickly and I am quarrelsome. I get into tussle with anyone over a simple issue. That I don't know probably. Now what Johari window is saying, how you see yourself, other person also see you in some different aspect. That other people also see. And other people do not know. You know swimming, you know singing, that you know, and your friends even know that these are the things that he has. But you read comics in your home that your friends suppose do not know. Okay. So this thing is what known as facade. The good things that you also know about and your friends also see in you, that become your strength. But you don't know what that you get into anger too much quickly. You cannot see on that, but others also can see. That becomes your weakness. So what weakness in you is? What you cannot see but others can see into you. That is your weakness. What is your strength? That you also see in yourself and others also. Suppose it is confidence even. And what is facade? That you only know about yourselves. আমি ঘরের ভেতর কি করি আমি জানি আর কেউ জানে না. That is your another persona or facade that you keep into yourself. অপরিচিত দেখেছো? হ্যাঁ? Multiple split personality. In daylight he was a কি ছিল? লয়ার ছিল যতদূর মনে পড়ছে. তাই তো? বাট রাত্রেবেলায় কি সাজে বেরোতো? পাগল সুপার হিরো. যাকে পাচ্ছে পিটাচ্ছে, খুন করছে. That was the facade. That you know, but others do not know. And what you don't know and others don't know, that always becomes unknown. এটা নিয়ে বেশি ভাবার নেই. আমি নিজেও জানি না আমার কি আছে, অন্যরাও দেখতে পায় না. So what to become a successful person, that came from the Johari. What we have to do? We have to maintain the facade. We obviously have to maintain the facade. You know, but others people must not know. And we have to decrease the weakness. That is a Johari window of a successful person. He has very few weaknesses and he maintains his facade. Okay. This same kind of 2x2 box will come into SWOT analysis. which I will discuss in second session.